Hi, my name's Mel Ortega. I'm from Miami originally. I've been here for over 20 years. I went to medical school in Mexico City on a fluke because I was there for vacation, and the next thing you knew I was in medical school there. I did all my medical education in Mexico until my postgraduate when I came back to Miami to do a year of pediatrics because my father was a pediatrician, and at one point I thought I wanted to be a pediatrician. However, I was definitely drawn to plastic surgery because it was the artistic side of medicine that I was drawn to, because I really wanted to be more like a painter and a musician. However, my father had convinced me that medicine still could serve me well by giving me an education and a means with which to earn a living, and at the same time it give me the outlet of creativity, which the artist truly needs. So plastic surgery has been good to me, and that I've been able to develop myself from an artistic standpoint with the work that I do. It just so happened that my focus on the aesthetics was what drew me to plastics as well, and that's what I've been doing since then. So I'm doing cosmetic surgery, which is very artistically dependent. You have to have a feel for what beauty is and what symmetry is and what proportion is, and only if you have a real good artistic perspective do you really have the ability to get these kind of results, what patients are looking for. I am a family person. I love my children. I have a son and a daughter who really are the apple of my eye. I derive great pleasure in spending time with them and finding what their interests and trying to partake with them in the things that they love. My son happens to be very artistically endowed. My daughter is endowed as well, but she does it more like in the performance. When you meet her, you realize she's a performer. She has a beautiful voice for a little girl, and I'm hoping one day she'll be able to pursue her passion for that as well. And I encourage my children to do that, because I think that if you have that kind of passion, that they're going to always be successful in their lives from a personal satisfaction level. Success, monetarily, in careers is all good and fine, but if they're not internally happy with what they're doing, then you're not really helping your children out. So I really focus on letting them express themselves as much as possible. I have gotten known for my tummy tucks. People tell me that I'm very, very good at this. I try to be modest about it, but they keep insisting, well, you're really, really good at it. So I have a feeling that the reason why they say that is because ever since I started doing them, I realized that tummy tucks were more than just an operation of, pulling down some loose skin and tightening up. I basically tried to get into the head of the woman who was coming, which is typically a woman, sometimes men, but mostly women, and tried to get into their head to understand why they were there, what they were expecting from this operation. And interestingly, not every single woman has the exact same idea of what it's going to do for them. And you even look at them, and their anatomy is different from one to the next. And you have to kind of come up with this plan that is individualized, which is what I think is true, because a lot of people would say, oh, tummy tucks, just make a pattern, cut the skin, move it, boom, that's it. But then you don't necessarily get results that they're extremely ecstatic of. I kind of looked at the concept that the person has 3 dimensions to them besides their soul, of course, and that the operation really had to take that into account. So I looked at each individual and I said, this is where their problem is, but let me point out to them where they have some other problems that the tummy tuck is also going to address. So what you ended up finding out is that they didn't realize how much improvement they could get from this operation, because it really does more than just 1 or 2 things. And so I enunciated to them all of the benefits that they would get. And obviously the one detracting problem is the scar, but the fact of the matter is that's the only negative. And there's so many positives to the operation that I've emphasized to them this thing and this thing and this thing. All of these things help. If you want to talk on it at a technical standpoint, yes, you get rid of stretched out skin, you get rid of scars, you get rid of stretch marks, you repair muscles that are separated. You'll even add liposuction to the equation and improve their contours on the sides. And ultimately what you end up is with a result that is way superior than just one thing alone. And that's why the patients have ended up being very, very happy, because they get this very dramatic improvement. A lot of these women are already mothers. They've done their childbearing. They suffered the ravages of pregnancies on their body, and they want to get back to the way they were before. And so this operation really does that for them, and it has a high degree of satisfaction. I don't necessarily want to get into technical terms, but the fact of the matter is there are different types of tummy tucks based on each patient's individual needs. So some patients who don't really qualify for a quote-unquote traditional tummy tuck sometimes qualify for something called a floater, which some people might think is like a mini tummy tuck, but it's actually way more elaborate than a mini tummy tuck. And it's for someone who is perhaps not the candidate for the traditional one, but still has similar needs for them and has similar expectations. So I've been able to adapt the operation to each patient's needs, and that's why they have these different names to them.